If you are waking up 1, 2, or 3 times a night to urinate, I want to tell you something that most videos on this topic get wrong. The problem is almost never how much water you drink. It is when you drink it, what else you drink, and a specific physiological change that happens inside your body after 60 that most people have never heard about. As a urologist, nocturia, the medical term for waking at night to urinate, is one of the most common complaints I see in my clinic. It disrupts sleep, increases fall risk, drains energy, and quietly reduces quality of life in ways people accept as inevitable. They should not. Today, I am going to give you the complete clinical picture of why nocturia happens, what specifically water timing has to do with it, what the evidence-backed behavioral changes are that actually work, and the one physiological cause that no amount of hydration adjustment can fix on its own. My name is Dr. Elizabeth Kavaler. I am a board-certified urologist and urogynecologist with over 20 years of clinical practice. Nocturia is one of the conditions I treat most frequently in adults over 50, and my guidance today is based on the International Continence Society clinical definitions and guidelines, Cleveland Clinic recommendations, and published urological research on behavioral interventions for nighttime urinary frequency. Nocturia has multiple causes, and understanding which one applies to you determines which solutions will actually work. The first cause is nocturnal polyuria. This is the most common cause in adults over 60, and it is the one almost no video explains. Nocturnal polyuria means your kidneys produce an abnormally large proportion of your daily urine output during the night hours. Here is the physiology. In younger adults, the body secretes a hormone called antidiuretic hormone, ADH, in higher amounts during sleep. ADH signals the kidneys to concentrate urine and produce less of it at night. This is why younger adults can sleep 8 hours without needing to urinate. After 60, ADH secretion during sleep declines significantly. The kidneys receive less signal to concentrate urine overnight. Production continues at a rate closer to daytime levels. The result is a full bladder at 2 a.m. regardless of how little you drank before bed. Nocturnal polyuria is clinically defined as producing more than 33% of your total daily urine output between the hours of 10 p.m. and 6 a.m. Research from the International Continence Society estimates that nocturnal polyuria is present in approximately 80% of older adults with nocturia. This is why simply stopping fluids at 6 p.m. does not solve the problem for most people. The kidneys are producing excess urine regardless of what you drank. The second cause is reduced functional bladder capacity. As the bladder ages, its muscle wall becomes less compliant, and its capacity to stretch and hold urine decreases. A bladder that held 400 milliliters comfortably at 40 may hold 250 milliliters at 65. Smaller capacity means the alarm goes off sooner, and more often overnight. The third cause is fluid timing and composition, which is where hydration habits do directly matter, and I will cover those specifically. Now let me cover the hydration habits that directly affect how much urine your body produces overnight. First, the 2-hour rule. The International Continence Society recommends stopping all fluid intake at least 2 hours before your intended sleep time. This is not about drinking less overall. Total daily fluid intake should remain adequate, ideally 1.5 to 2 liters per day. It is about front-loading your fluid intake into the morning and early afternoon and progressively reducing intake in the hours before bed. Drinking 500 milliliters of water at 9 p.m. when you sleep at 11 means that fluid will be actively processed by your kidneys during your first sleep cycle. Shift that same 500 milliliters to 2 p.m. and your kidneys process it hours before you lie down. Second, caffeine timing. Caffeine is a diuretic. It actively increases urine production by inhibiting the reabsorption of sodium and water in the kidney tubules. Its half-life in most adults is 5 to 6 hours, but in adults over 60 with slower hepatic metabolism, the effective half-life is often 7 to 9 hours. A cup of coffee at 3 p.m. can still be producing a meaningful diuretic effect at 10 p.m. The clinical recommendation for anyone with nocturia is to cut caffeine completely after noon. This means coffee, tea, cola, energy drinks, and any supplement containing caffeine. Third, alcohol in the evening. Alcohol suppresses ADH secretion directly. This is the same hormone I explained earlier that tells the kidneys to concentrate urine during sleep. 1 glass of wine at 8 p.m. actively disrupts your body's natural overnight urine concentration mechanism. Many patients are surprised to discover that their nocturia improves significantly simply by moving alcohol consumption to lunch or early afternoon, or eliminating evening alcohol entirely. Fourth, sodium in your evening meal. High sodium intake at dinner increases fluid retention in the tissues during the day. When you lie down, that retained fluid redistributes from the tissues back into the bloodstream. The kidneys then process this fluid load during the night hours. This is one of the reasons why ankle swelling during the day is a significant predictor of nocturia at night. Reducing evening sodium directly reduces the overnight fluid redistribution load your kidneys have to manage. Hydration timing alone addresses only one component of nocturia. The behavioral intervention with the strongest evidence base for people with reduced functional bladder capacity is bladder training. Bladder training involves deliberately extending the time between bathroom visits during the day to gradually increase your bladder's functional capacity. Most adults with nocturia urinate at the first sensation of bladder fullness, which trains the bladder to signal urgency at increasingly low volumes. Bladder training reverses this pattern. The protocol is straightforward. During the day, when you feel the urge to urinate, practice waiting an additional 5 minutes before going. Over 2 to 4 weeks, extend that interval progressively to 10 minutes, then 15, then eventually 20 to 30 minutes beyond the initial urge. Research published in the Journal of the American Geriatric Society found that bladder training reduced nocturia episodes by an average of 54% in community-dwelling older adults over an 8-week program. Bladder training does not change the nocturnal polyuria mechanism, but it does increase functional bladder capacity, which means the bladder can hold more urine before signaling urgency, giving you longer stretches of uninterrupted sleep even when the kidneys are producing more urine overnight than they should. I want to be honest about something that most videos on this topic do not say. If you wake up 2 or more times every night to urinate, fluid timing adjustments alone may not solve it. And if they do not, that is important clinical information. Nocturia that persists despite proper hydration habits, caffeine and alcohol reduction, and evening sodium management may be driven by one of several underlying medical conditions that require evaluation. Sleep apnea causes repeated microarousals during the night that the brain interprets as a need to urinate. Treating sleep apnea consistently reduces nocturia. Uncontrolled heart failure causes fluid redistribution at night that the kidneys must process. Uncontrolled diabetes and diabetes insipidus both produce excessive overnight urine output through entirely different mechanisms. And certain medications, particularly diuretics taken in the evening, actively drive nighttime urine production. If your nocturia is waking you 2 or more times per night, please make an appointment with a urologist. Bring a 24-hour fluid diary, tracking what you drink and when, and how much urine you produce at each void, including overnight. That information takes 1 day to gather and gives a urologist the most precise diagnostic picture available for nocturia. It changes the clinical conversation from guessing to certainty. Waking up at night to urinate is not an inevitable part of aging. It is a symptom with identifiable causes and effective treatments. The hydration habits I have outlined today address the component of nocturia that fluid timing directly affects. Bladder training addresses the capacity component, and for the underlying physiological and medical causes, a urologist can guide you through evidence-based options that go significantly beyond anything you can achieve with lifestyle changes alone. Better sleep is not a luxury. It is foundational to everything else your health depends on. Take this seriously. I am Dr. Elizabeth Kavaler. I will see you in the next video.